Hi, it's Susan, and I am here at Overlake Medical Center in Bellevue with their president and CEO, John Duarte. Thanks for having me.
Thank you.
And we want to talk a little bit about Medicaid and how important Medicaid has been and is to our community. We call it Apple Health in Washington State. And so I wondered if you could talk a little bit about the impact Medicaid's had here in Washington State.
Oh, sure. I think Medicaid is one of those programs that really is essential for those with the least means to pay for health care. And 20% of Washingtonians are covered by Medicaid, 800,000 children in that as well. So it's a significant safety net program for those that had the least means to pay.
And if we talk about just kind of births that are covered
Sure.
and kind of how cuts might impact pre and postnatal care.
Yeah, so 50% of births in the state of Washington approximately are covered by Medicaid, and that really provides a significant amount of prenatal care, postnatal care for patients, and is really important to long-term health care costs in the state, and also just general wellness of the folks that are covered by Medicaid. So really important to have that be maintained. Lot of potential downsides from readmissions to higher costs through the lifetime of patients if Medicaid were to be cut.
And if it were cut, what does that mean for hospitals and health providers?
So hospitals and health systems are struggling significantly still, particularly in the state of Washington. Most, if not all, healthcare systems are operating at a negative operating deficit. Cash reserves are declining, and Medicaid cuts would throw those systems into further turmoil. So having to potentially close services, OB providers in particular have been significantly impacted by Medicaid, and we could see more program closures, particularly in the rural parts of the state. So it would be really devastating to the system.
So sometimes when we invest in making sure everyone has access to quality, affordable health care throughout our state, it means that we have a healthier ecosystem for everybody. We have more providers, our hospitals are running better, people get better health care, and I'd argue in the end, we also all save money.
Absolutely, yes, in the long term for sure, yeah.
Well, thank you.
Thank you.
It's good to talk to you.
Thank you.